This is Bloomberg Businessweek with Carol Massar and Tim Stenovec on Bloomberg Radio.
Happy anniversary, baby. Got you on my mind.
There is a big anniversary coming up in February. It's for none other, Tim, than Meta Platforms.
Oh, I thought you were going to say the 1 year birthday of my daughter.
Oh no, my God, soon.
Yeah, soon. I know, it's been a year.
Right.
Anyway, this is not about me. This is about Meta Platforms. The company formerly known
Almost.
as Facebook turns 20 years old. And with that comes a story from our old Aisha accounts and Sarah Fryer that looks at how Mark Zuckerberg has become deeply engaged in his company's AI efforts. But just because Zuck is paying close attention to something, Carol, doesn't necessarily mean it's going to be a success.
Do you necessarily, if you work there, want him to be paying
Have
close
you heard
attention?
Have you heard of the metaverse?
Tim, I'm actually in there right now.
Okay.
No, I'm not. All right. Well, Sarah Fryer is big tech team leader here at Bloomberg News. She's also the author of No Filter, the inside story of Instagram. She joins us, of course, from our San Francisco bureau, and also with us.
We got Joshua Brustein here, technology editor for Bloomberg Businessweek. He's here in the Bloomberg Interactive Brokers studio. We should note Sarah's story is featured in the year ahead issue of Businessweek magazine. It's available on newsstands now, co-written with Aisha Counts. You can also read it now on the Bloomberg terminal and at bloomberg.com/businessweek.
All right, where to begin? This is a great story, guys. Joshua, let's start with you. Meta Platforms, they've been, working on a lot of things and on AI for more than a decade. But over that time, he has also focused on a lot of other stuff. I mean, this is what he seems to do. But take us back to how the story starts, the summer of 2021, and where someone said something, not just to someone, we're talking about the CEO of Google, and it kind of maybe caught him off guard, maybe a little bit.
Yeah, so Aisha and Sarah recount an event that happened in Sun Valley where Sundar Pichai, the head of Google, came up to Mark Zuckerberg to personally compliment him on a breakthrough in Meta's AI team. And this is exactly...
He was like, high five, got it.
Yeah, and this is exactly the kind of thing that Mark Zuckerberg wants. Like, even though he is one of the most recognizable people in the industry, started one of the most valuable companies in the world, he's very touchy about the fact that people don't see him as an innovator. And so here you have Sundar Pichai saying, hey, great job on innovating on like this very important thing. And the problem is that Mark Zuckerberg doesn't actually know what Sundar is talking about.
That's rough.
And so I guess, it, goes back to California at the end of this is like, hey guys, like read me in on this stuff. What's going on?
I didn't get the memo.
Wait, Sarah Fryer, come on in here. Is Mark Zuckerberg the type of person, like if I'm scrolling through Instagram and I see a photo of his posted, like, do I have to tap it and like it or else his feelings are going to get hurt? Like, do I need to do that?
I mean, so the thing is, he's pretty chill about being memed, about being mocked. Like, he's been the butt of jokes in the tech industry and beyond for all of those 20 years of Facebook's existence. They made the movie about him in Hollywood in 2010. So that doesn't bother him as much. What bothers him is that people don't think of him as a technologist, like Josh said. And, really there's this idea, and it's partially true, that a lot of Facebook's, Meta's successes are from acquisitions, from copying their competitors, from killing their competitors, to try to just be this ruthless capitalist building Meta into this humongous company, as opposed to like a really creative visionary. And so that kind of rubs me the wrong way. Like, you'd rather be seen like a Elon Musk or Jeff Bezos, somebody who really just like brought something new into the world. And I think that AI, this whole shift at the company that we document, gives him that chance. I mean, he can legitimately say that Meta is building things that haven't been built before and sharing them to further the industry in a really critical direction. And so I think that this is an exciting moment for him at year 20 of Facebook. The problem is, he's been excited before. He was excited about crypto. He was excited about live video. He was excited about all these things, latest being the metaverse, that just didn't quite kick off the way that you would expect, or
Well,
that he expected.
Can we go backwards for a second? Yeah, let's talk about Meta, right? I mean, he changed the name of the company. Talk about being all in, and you guys include in the story, that he's lost about $50 billion on the effort, and we kind of make little jokes about it, but we're kind of trying to figure out what is happening. So first of all, can we just take a step back, Joshua? Is Meta is it still a thing he's pursuing, or the metaverse?
I think that Meta would definitely say they're still pursuing the metaverse, even in a lot of the AI things that they release.
Is it compatible, is it in their pursuit of AI?
The company line is that AI will help bring about the metaverse. But clearly, the release of ChatGPT has changed the discussion in the tech industry and pretty much left the metaverse behind. If Meta thinks it's going to happen, they're kind of off on a hill by themselves at the moment. Yeah. Everyone else is just talking about chatbots and what else AI might bring along. So if they can find a way back to that thread, they'll get there, but it's not clear they will.
Okay, so I guess my question for Sarah is about what Facebook Meta, actually has when it comes to the metaverse. AI, sorry. I'm still thinking I'm so confused. This name change, I'm still calling it Google too. So I guess that's an issue.
Twitter, X.
But what are they actually working on when it comes to AI? And you make the point in the story that the company first made a big investment in AI over a decade ago at this point, Sarah. But where's AI and how do consumers and Facebook users actually interact with it?
Yeah, so that latter part, consumers and users reacting and interacting with it, is the new part. But Meta has been working in AI for that decade, as you note, and it really has been an open effort. And I think that's allowed them to recruit some of the best academic minds, because they know that if they work for Meta, their work can be public, it can be recognized, it can be used by outside developers, and their Llama model is very popular with startups, with those who want to develop AI without paying GPT, plenty of their cash. And so I think that they really have a strong position here. They invented PyTorch, which is a very important tool. How that is being implemented in Meta's product now, it's kind of behind the scenes. It's helping the algorithm, trying to surface better content for people and get around Apple's privacy rules. It's trying to make it possible for people to create content more smoothly, talk to chatbots. It actually is improving their advertising system. So all these little ways that are actually really lucrative for the company, that AI is being implemented. But when it comes to generative AI, which is this new era that everyone seems to care about, the consumer-facing stuff is not as exciting, but I think that it's still very much the beginning of this industry.
So we're having some fun with this company. It's still a $950 billion market cap company. It's massive.
That, by the way, had a pretty good 2023.
Exactly. And it's up again about 4.5% on the year so far, and we're just early in. But having said that, what I love about this story too, and Sarah, let me go back to you, is you kind of get a feel of some of the stuff that's going on and the kind of conversations. You guys talked to a lot of employees, it sounds like, right, who obviously gave you some background color on what he is like as a leader, for better, for worse. And maybe, I don't know, do we start with the avatar and his obsession with that? Go wherever you want on this. But we get some good color about what's going on kind of inside the Meta universe of the company.
Yeah, so like many big companies, Meta even though it's founder-led, like Zuckerberg is one of the last remaining founders of a big tech company, and he's all in. But when he gets laser focused on something, he moves employees to it. He pushes all the resources in that direction, and that gives employees a lot of whiplash, a lot of like, okay, well, you used to care about crypto and this whole idea of Libra. Now you care about Instagram Shop. Oh, and now you care about the metaverse. Oh, now you care about AI. And these people are just getting like moved to projects that are the latest of Zuckerberg's great inspiration, right? And then sometimes they work out, sometimes they don't. We've seen things like Reels really work out. We've seen the metaverse kind of fall flat. And so it's kind of a coin toss. And really the company is still driven by Facebook, by Instagram, by that advertising engine, by that attention engine that we have talked about for so long. And they haven't figured out their next act. So Facebook at 20 is in a kind of precarious spot. Like, they have to figure out, where does that next big growth spurt come from? How can we either use AI to juice more out of what we've got, or come up with something new? And it sounds like the metaverse is just not going to be that something new in any sort of reasonable time frame to get the company back on. I mean, they are on a growth track. They had a really great stock year, but there's always the question of how long that can last.
Kind of what's next. Yeah.
Sarah, I think one thing that's interesting as we're talking about kind of the personal nature of Mark Zuckerberg's leadership here, you have this great detail about how obsessed he was with the avatars in the metaverse, and also detail some of the chatbots they released, which are kind of weird. It's like Tom Brady pretending he's your buddy. And is part of this that
Joshua, there's nothing weird about that. That is so normal. Anyway.
Is part of it that Mark Zuckerberg is involved here and kind of imposing his taste, and maybe he just doesn't have great taste?
I mean, look at what he's been posting just this week. I mean, this isn't in our story, but he posted today, the feeling when your wife catches you in your doomsday bunker. Yeah, we can all relate to that, right? We all know that feeling. He's playing, video games in his bunker, or I think that this was actually yesterday that he posted that he's trying to raise cows on a diet of macadamia nuts and beer in Hawaii.
There's nothing wrong with that, Sarah.
Hold on.
We're totally all in on that.
Sarah,
we just want to,
but if he thought that was in this era of populism, if he thought that was the way to our hearts, is to be the most billionaire of billionaires in personal projects, I don't know. So I think that a lot of the things in there's a moment in the story where he demonstrates something at a conference, a way to have conversations with holograms of your colleagues and friends, things that are really exciting to Zuckerberg the nerd, that are maybe not gonna catch on with your average consumer, and people just like to log on to Instagram, So I think it's gonna be. It's definitely exciting when you're put on one of his passion projects at Meta, but it's also a little bit of a toss-up. Is this going to work or not?
I guess this is what happens when you're recovering from ACL surgery and you can't do MMA. You just start raising cows, building catapults, and hiding out in your bunker.
That's right.
Sarah, do you think he regrets renaming the company Meta, given that it hasn't stuck and there's no indication the metaverse will stick?
Okay, well, this is a personal take, but I feel like it was a brilliant renaming, because when the company was Facebook, everyone thought of Cambridge Analytica, they thought of the 2016 election, they thought of Facebook and your data. Now that it's Meta, they're thinking of the company in a very different way, as this conglomerate of a bunch of things. It gives them an ability to kind of branch out into whatever they want to be, whether it's metaverse or not. It is kind of embarrassing that the metaverse hasn't caught on yet, but I think it was also very embarrassing to be Facebook when that network has so much baggage in the minds of consumers and investors.
It's kind of fascinating. Do you think, I don't know, Joshua, 20 years? Stick around for another 20 years?
Guess we'll see.
Yeah, exactly. I think the avatar will continue to get better, though, right?
I want to know how those cows are doing after 20 years.
Well,
they're going to get eaten. I know.
It's a great, listen, there's so many great morsels, if you will, in this story. And I'd love just the, sorry.
Some macadamia nuts.
But the Avatar stuff alone, like we all remember it, we were living it. It's a great read, a great story. It's in the new issue of Bloomberg Businessweek. It's the year ahead issue. Our thanks to Sarah Fryer, big tech team leader at Bloomberg News. Check out our book if you haven't already, No Filter, the inside story of Instagram. And of course, Joshua Brustein, he's technology editor for Bloomberg Businessweek. You guys are just what we needed on this Thursday. It's been quite a week. This is Bloomberg. Well, we talk about it all the time, just how big a contributor it is to the economy. And we're talking about healthcare. Spending on health accounted for 17.3% of U.S. GDP in 2022 for a total of $4.5 trillion. That's according to the Centers for Medicare and also Medicaid Services, Tim.
Yeah, and last week we got the numbers from the BLS. Healthcare adding 38,000 jobs in December, second in hiring only to the government. A lot of money.
Yeah.
A lot of people.
Yeah.
When it comes to healthcare in the U.S.
And we got a lot of questions. So we think about how will AI transform this? What about the role of private equity in the hospital and healthcare space? Will it cut costs and most importantly, improve patient outcomes? We've got a great guest to really take a big view perspective on this. Robert Garrett is Chief Executive Officer of Hackensack Meridian Health. I know the system well. A New Jersey-based hospital network, 18 hospitals, 7,000 doctors in more than 500 locations that provide care. He is also chair of World Economic Forum Health and Healthcare Governors Community. And before he heads over to Davos for next week, he joins us here in the Bloomberg Interactive Broker Studio. Happy New Year. Nice to have you back. How are you?
I am great. Happy New Year to both of you. Great to be back, too.
It feels good to be back. It feels like we're kind of back to normal, as they say.
Sort of, yeah.
Sort
Yeah, because
of.
we all just get COVID once a year and,
Yeah.
I
put
just
it
had
behind us.
COVID for my third
Becoming
or
a
fourth
little
time.
too routine, right?
Yeah, it is.
It is kind of weird. So let's start with Davos. You're getting over there. You're heading
Yes.
over there. What's top of mind for you?
So, as in this new role as chair of the healthcare
What
governors
does that mean? What
community.
exactly is that?
So what that is we convene healthcare stakeholders and we decide what the priority topic or topics should be. And as the chair, I have to really convene that group. There's a steering committee. And then I have to actually chair the meetings that actually take place there. So this year, when we thought about all of the topics over the last few years, there was health equity and the inequity that exists in underserved countries versus the Western countries. I think like a 30-year gap in life expectancy as one example.
Yeah.
Then we thought about healthcare access and not having equal access across the globe to healthcare and healthcare programs. We thought about climate change and the impact climate change has on health, and then we thought about improving healthcare outcomes and adding more value to the healthcare system. All of those, if you think about all those four topics, they all are going to be so impacted by what is really the most profound innovation of our.
Don't say it. Don't go there.
I know,
Don't go there.
I won't. I'm tempted, but I won't.
You know, every time we say it, you have to drink a
Bitcoin
shot.
ETFs. The Bitcoin ETFs providing healthcare.
Right.
Is that what you're going to say?
No.
Yeah.
Okay.
Yeah, the way they say it's the penicillin of our generation. But you know what? So we thought AI really did make sense because it really wraps around all four topics. So the steering committee, we had those discussions. They agreed. And so what's going to happen at Davos is we're going to have a discussion from some of the stakeholders, pharmaceutical company CEOs, as well as device CEOs, device maker CEOs, healthcare system CEOs, as well as insurers, all around the table, hearing about AI, what their take is, where the impacts are going to be, what the pitfalls might be, what safeguards we have to set up. Then we're going to bring in the policymakers. So we're going to have health ministers from different parts of the world come in. We're going to hear from their perspective. Then the policymakers leave the room and the governors get back together and we break out into small groups and we decide what our action plan is going to be going forward. And we leave there not just with what the problems are or what the challenges are, but what are the solutions. And I'm committed as the chair to meet once a month following Davos. So it's not going to be something that's going to be put on the back burner till next January. It's going to be talked about.
Okay, so you've thought a lot about AI in healthcare. Help us understand. I mean, I think a lot of people have experience with ChatGPT and understanding what generative AI can do, but apply that to healthcare space for us. And if you think about the world that you want to see in 5 to 10 years, paint that picture for us. What does it actually look like if AI has helped healthcare?
Well, the first thing I would say, Tim, is really identification of disease earlier. I think that really probably will be the most profound impact, and we're already seeing some case studies and some pilot programs that are indicating potentially some breakthroughs there. At Hackensack Meridian, as an example, we have a pilot going on now that is identifying stage 3 kidney disease earlier, and that has some profound impact, because if you can really identify it early enough and apply some prevention.
But how does it do that?
Well, the technical piece is through algorithms and patient data. They're able to.
So basically, correct me if I'm wrong. The patient would come in and be asked a series of questions,
correct,
and the answers to those questions would go through some sort of algorithm,
and come back and say, okay, this patient, in 3 years from now is likely to have, advanced kidney.
That's interesting, because I think a doctor could do the same thing, right?
Well, they don't always have all the tools at their disposal. This can aggregate imaging. It could aggregate patient data, family history, demographics. It's just a lot for a clinician to really do.
It's almost like having a massive spreadsheet and putting all the endpoints and from different sources and just saying, almost like a probability study, if you will, statistically, and saying you're more likely to have these problems.
And another good example, to your question, Tim, is in radiology and imaging. So a radiologist has to read, an average radiologist in a given day has to read like 150 scans. Wow. Through AI, they're able to then tell the radiologist these 3 or 5 need priority based on the patient's history, the data in the medical record, and the scan itself. You need to pay attention to these because they may need treatment earlier on.
I see.
So that's been really, really helpful. So when I think about AI in the future, I think about some of the clinical outcomes that can improve. There's also the efficiency side too, which is...
Hang on for a second, because I want to bring one element into it, just because we have a headline crossing the Bloomberg.
Sure.
UK Prime Minister Rishi Sunak authorizing joint military strikes with the U.S. against the Houthi rebels in Yemen, and his cabinet approved, according to a person familiar with the matter, as the allies look to deter further attacks on commercial vessels in the Red Sea. So his cabinet approving the decision on a conference call today. Airstrikes possibly as soon as later in the evening, according to those familiar. So we continue to see heightened tensions in the Middle East. The reason I wanted to jump in, Robert, is that I do feel like there's going to be a lot of conversations in Davos about risk that's out there. We've got 2 big wars. You talk to geopolitical strategists and they say, actually, there's about 100 levels of some kind of outbursts or activities, smaller ones, attacks around the world. Some say we are already a world at war. So when you look at the healthcare issues that, yes, are so important to ministers, how are they going to think about prioritizing that, the money, the need, the efforts, when you've got some really serious situations going on right now?
I mean, it's going to be a challenge, no doubt, for even in the U.S., I think, in terms of, our budgetary priorities, right?
Right, and even after coming off of a global pandemic that shut the world down,
correct.
It's interesting how things can be put to the side.
But, if you think about it, just in terms of even climate change and its impact on health, I mean, that's going to continue to get worse and worse. I mean, I saw a statistic just the other day that I think between the years 2030 and 2050, 250,000 more people each year will die around the globe because of climate change's impact on health and health care. So we can't ignore those problems as we have these geopolitical crises out there.
But it does make it harder, right, for countries
harder.
And ministers to kind of get their initiatives.
Absolutely, and that's why our voice as a healthcare provider has to get even louder and say, okay, you know what, we understand you're challenged and you have these immediate issues, and there's a war in the Middle East, and we have Ukraine, and we have all these other situations out there. But we can't ignore everything else. I mean, one of the
and just got about 30 seconds, then we'll come back and talk more.
Yeah, just quickly, Carol. One of the lessons from COVID was that too much was probably put on the back burner. Like as an example, in healthcare, people didn't come in for their screenings, and we're seeing higher rates of cancer, higher rates of cardiac disease, higher rates of diabetes because of that. So I think what the lesson learned for me is, hey, you know what? We're always going to have some crisis, but we need to be multifaceted, and we need to pay attention to a multitude of issues.
We want to get back to our guest. Robert Garrett is with us. He's Chief Executive Officer of Hackensack Meridian Health. As we mentioned, massive healthcare system in New Jersey, 18 hospitals, 7,000 doctors, and more than 500 locations providing care. Also, Robert is chair of World Economic Forum Health and Healthcare Governors Community. As we mentioned earlier, he's going to be heading to Davos over the weekend. Still with us in our Bloomberg Interactive Brokers studio. One thing I want to ask you about money in hospitals. We've done a lot of reporting about it. Private equity owning about 30% of for-profit hospitals. A lot of them are in rural areas of the United States. You guys are a nonprofit, right?
Correct.
What's the difference and what advantages, disadvantages? Help me understand being a nonprofit hospital.
Nonprofit hospital, you are tax exempt, and you have a mission to serve your communities. You have to have a board that's representative of those communities, so you don't have stockholders or shareholders that you have to report to, and any margin or any profit that we make as a not-for-profit gets really reinvested in the health system, whether that's through capital investments to improve infrastructure or new programs or services, or our people, our 36,000 team members.
So what do you make of all the money that is going into the for-profit hospital system? Because you've seen some of the horror stories. We've reported on it here at Bloomberg. Good or bad?
You know, I think it's a mixed bag is how I would put it. Let me explain that. I think it's on the good side, coming out of COVID, so many hospitals and even health systems were stressed, particularly in rural areas, and they would have closed if it wasn't for maybe some for-profits or private equity coming in and helping to bail it out. The problem, of course, is what's the mission? Where's the priority? I do think that private equity is probably here to stay in healthcare for some period of time. So I look at it as if it's coming to my market, coming to New Jersey, private equity companies, which they have. They're gonna be there with or without Hackensack Meridian Health's partnership. So I actually am looking for ways that maybe we can partner, and maybe yes. So maybe there are some joint venture opportunities where our mission still will stay true, but we'll be able to provide some services and programs and have a partner that can help us provide them. So one example of that is we recently announced a partnership with a company called One Medical, which is, you guys are probably familiar with them. They're part of the Amazon network. They were coming to New Jersey, again, with or without Hackensack Meridian Health. They are a group of primary care providers. We do have a shortage of primary care physicians in New Jersey. So we thought it's best to partner with them to make the One Medical group part of our medical group at Hackensack Meridian Health. And we're able to expand primary care coverage, and we're going to be opening up new primary care centers throughout New Jersey with One Medical. So that's an example of where I think it can be positive.
Do you worry, though, that the interests of a private equity firm aren't necessarily aligned with high quality patient outcomes?
I do, Tim, and that's why I think that wherever possible, if there's ways that we can partner and keep the not-for-profit mission in healthcare, I think that's positive. Now, of course, there's going to be give and take if you do have a true joint venture. But we would only find, from our perspective, we would only want to partner with a company that shares our values and our mission. But yes, I'm basically, unchecked. I think that private equity may not necessarily have the same interests as a not-for-profit health system.
When you look at the data, which ownership structure has the best patient outcomes?
I still think the not-for-profit hospitals and the not-for-profit health systems have the best patient outcomes that I've seen, and that's patient quality and patient safety data. Now, maybe from an efficiency perspective, some private equity and some for-profits do have a decent track record. So their length of stay might be lower, their readmission rate might be lower, and those are important factors. But what I consider most important are quality and patient safety outcomes.
When you talked about in New Jersey that there's not enough primary care doctors, and I do wonder, I'm going to be a little crazy, but are we getting to a point where it feels like we keep talking, Tim, right, with guests about shortage of healthcare workers, nurses. We've been talking about that for years. Like a little bit of a Hunger Games scenario where it's going to be really rough to find the care and the right people that you need to do. I feel very blessed in New York, but still.
The doctors who I know are so burned out.
Yes.
And they're early in their careers.
Yeah.
The work that they do is so important, but they're not, it's not like, these other jobs where people, now they only have to go into the office 3 days a week. No, you're a doctor. You have to be on site. You're on call on weekends. Like, yes, their compensation is good, but it is tough work.
The burnout actually got much worse as a result of COVID. So when we've done our surveying, we see that, with doctors and nurses. But the statistic nationally is 1 out of 5 nurses, as an example, have left the profession since COVID. And what's even more scary than that is 1 out of 3 in recent surveys are saying they're seriously thinking about leaving the profession. So we already, as Carol said, we already started with a nursing shortage. The one thing that's common to doctors and nurses in terms of burnout is they are burnt out and frustrated with all the administrative tasks that they have to do that take them away from direct patient care. So that's where technology will come in.
When does it come? Because we've been talking about why can't I just walk in with a card and here's all my information, here's all my latest tests, and just tap it.
Yeah.
You got it. And it gets updated.
Good luck.
It absolutely.
Maybe that's what we should create.
It absolutely should be that way. But I'll tell you one technology that
in just about 40 seconds.
Okay, one technology that is coming into fruition now that we're doing at Hackensack Meridian. We're piloting. It's going to be rolled out, and that's virtual nursing. So through remote connections, a virtual nurse can help the bedside nurse, and they can do a lot of the administrative tasks, the things, the charting, the admission and discharge, charting that needs to be done, which frees up the bedside nurse to spend more time with the patient.
To actually care for the patient.
Actually, and we're doing that with physicians too, where they're able to spend more time with patients. That to me should be the major focus.
Well, a million more questions we have. Tim and I really get into the healthcare space, lots of things. So hopefully you will come back soon.
I sure will.
We would
Thank you.
Have a safe trip to Davos.
Thanks very much.
Be well. Robert Garrett, and good luck with everything. Robert Garrett, Chief Executive Officer of Hackensack Meridian Health, as we said, Chair of World Economic Forum Health and Healthcare Governors Community. This is Bloomberg.